Diepsloot is a township 25 kilometers north of Sandton, Johannesburg, where unemployment is as high as 60% of the population. Transport is expensive, so proximity is important for residents when finding work. For entrepreneurs looking for an opportunity, where do they find the support they need to help build their businesses? Less than 5 kilometers away from Diepsloot is the Riversands SMME Incubation Hub, where fledgling entrepreneurs learn the skills they need to thrive in the marketplace. There's hope that these businesses will contribute to the government's efforts to integrate the township economy into the mainstream economy and bring jobs to Diepsloot.
This platform is here to basically enable and develop small to medium enterprises as a means to develop the economy. What makes us unique, first of all, would be our size. We currently have 158 units available, 157 businesses on campus across a 38,000 square meters space. Our operational philosophy is probably one of our biggest differentiators. We are not prescriptive in the manner in which we actually support the businesses. Our focus is to add value determined by the entrepreneurs themselves. So it's really important for us to be a learning organization that's always looking at ways in which to really support businesses in a manner that really makes sense to the entrepreneurs themselves.
They affirmed my idea and said, look, go ahead. We are here to support you as much as you are bringing something that is different to the hub, which will add on to the hub. And voila, Black Star Coffee Bar was born. So when I came here and I started setting up, I was thinking, okay, now I need employees. Where am I going to get people to work in these shops? And fortunately for me, there's a community just across the river, which is Diepsloot. Between the businesses that I have at the hub, I've got 15 people that we have permanent jobs for. It makes me happy that I have contributed to the economy of the country. I'm one of the people that the government is always stressing.
Another young entrepreneur who's providing employment for 3 people with her business is Seola Mashamaite.
We're an ISO 17025 accredited calibration laboratory. So we calibrate instruments like thermometers, hygrometers, ovens, incubators, anything that has to do with temperature and has to be verified. Currently at university there isn't any qualification that you can study towards being a metrologist. So any engineering degree would be a good start, and then from there you do individual courses that are offered by private institutions. The biggest impact would be the employing of the young people that were previously unemployed. The plan is to give them a skill that they would be able to go out here and they can be a qualified metrologist when they leave us, and with the skill they have capabilities of earning more, and that helps their families and get out of the cycle of unemployment.
South Africa's innovation pioneers are changing their industries with their sights firmly on the horizon. From innovative ways to providing skills to an app that puts specialist care in the hands of caregivers in outlying areas, the Vula app brings ICT digital technology into the healthcare sector.
Typically, a rural health worker would see a patient which he or she thinks might need specialist opinion. They complete a very short form on the app. The information gets sent straight to the specialist on call. The specialist on call can respond using the chat system that's built into the app, and they can help the patient accordingly. What's been amazing is that the response time from the specialist has been brought down to less than 15 minutes. That means really that the public health system has leapfrogged the private health system in some ways, because it's very hard to get hold of a private specialist within 15 minutes. So it started off with ophthalmology only, which is eye care. It's now in 14 specialties. The busiest one is orthopedics, a lot of trauma cases, broken bones. Other big ones are general surgery, internal medicine, obstetrics and gynecology. And these are really helping meet some of the major needs in our country. The other nice thing is that data just pours in, because it's making the lives of both the rural health workers and the specialists easier. It's collecting a lot of data that's used by health administrators. It shows where all the hotspots are, where many referrals are coming from. And a lot of the head of departments are now adapting their services according to this need, which before they had a feeling for, but now they've got data to show their health managers where the needs are. Our vision for the future is to take this African innovation global. I think it'll be very useful both in other African countries as well as other countries that face similar healthcare problems. A lot of first world countries also have problems around referrals and giving advice to rural areas, and I really think that we can showcase this at a global level.
Innovation means change, whether through an app or an incubator. This new way of doing business has the potential to create jobs, transform the workforce, and drive growth by creating new industries and new services.